Hey everybody, Justin Feldman, Feldman Physical Therapy and Performance. John and I are back again and want to follow up on last week's video. We were talking about what you should expect from your first visit to physical therapy, and now I want to talk a little bit about what you might want to expect from the rest of your visits to physical therapy. So John, what should we expect?
Well, Justin made a great point, first visit versus all of your follow-ups. So first visit, obviously, we're going to recap. We, do a full intake, full evaluation, find out what we're actually working with, what the plan of attack is going to be. Follow-up visits really depends on what's actually going on with your particular situation. So whether you have a lot of acute pain, it was a really traumatic incident, or whether it's just something chronic that's been going on for a while, whether your issue is a joint issue and you need more manual techniques and soft tissue work that we can do or licensed physical therapists can do, or is it more of a strength related issue or a combination of one of those, or a combination of both of those. So some people are going to need more manual techniques, and then we may set you up with a handful of follow-up visits, and then okay, we're going to give you some strength work now to do, and we'll set you up with a good plan, some videos, a good knowledge and understanding of your exercises in order to strengthen. Or sometimes it's, hey, you're just super weak here, so let's set you up immediately with some strength work and strength exercises, and we'll kind of see you in a few weeks once we give you a chance to work on them and get a good foundation of strength on your own. Or some people don't even do their homework, in which case they're going to need us a little bit sooner. So your follow-up visits are really going to depend on your specific situation, but you can expect one of a couple of things. You may need to see us for some manual techniques for a few visits, and then we'll give you some time to work on your own, or you may just need some strength work right away. Those are the two most common things I think that we see, Justin. So that's pretty much what your follow-up plan will be, and we take it from there.
Yeah, so I think the big takeaway there is you don't necessarily need to expect to come in 2 to 3 times a week for 8 to 12 weeks.
Right.
Or, one of the things we get a lot of is people saying, oh, my doctor wrote a script for 3 times a week for 12 weeks. And so, one, they think they have to do all of those. It's not like antibiotics. You don't have to do the whole thing.
That's a lot.
Right. Also, that's really just a recommendation or a guideline in the way that we work and the one-on-one environment. I can count only a handful of times where I thought someone needed to come in multiple times a week.
Right.
Really, being able to get them in once a week and get them through it, and then pretty quickly trying to get them more independent with what they're doing so they don't have to come in so frequently.
Yeah, we get a lot done with our one-on-one visits in a full hour than sometimes you might get going 2 or 3 times a week. So, it's something to keep in mind.
Sounds great. All right, we'll see you right back here next week. Have a great week, everybody.